Melany Dyer. I'm the physician lead of Shuswap North Okanagan Division of Family Practice. Tracy, your ever-energetic executive director, has compiled a lovely video of all of the initiatives that your division has undertaken this past year. And I would like to just thank Tracy and Peggy for their continued due diligence, their wonderful work, and their absolute commitment to doing the work of the Shuswap North Okanagan Division. Your SNO initiatives have a common theme, and that is community. And it's very fitting that we're here at McGuire Lake. This lake has been part of the salmon arm community since the late 1800s. It was part of the McGuire homestead and later became an area that the public could use for skating, for walking, and for pure enjoyment. It's on the grounds of the Shuswap Lake General Hospital and is a wonderful, wonderful community resource. This year at SNO, we have done many community-based initiatives, created connections, and grown our collaborations with many different partners. At the level of the interior health, we have some new people, new organizational structure, and there will be continued changes as the political scene unfolds. At the end of the day, what remains important is the work that you do with your patients day in, day out. The political will at the current time is to develop more of the patient medical home and the primary care home. Again, what remains important is what you do day in, day out. And it's that connection with your patients and your community that SNO will continue to support. I remember last year when Dr. Samantha Nutt talked to us about leadership. One of her 4 lessons in leadership was, if what you're doing feels difficult, it's because it's worth doing. The other one was tenacity. Another was, if nobody's listening, change the message. I've always considered my work as a physician as one of life's richest blessings. A blessing is that place and that space that we give to each other where we are allowed to be our authentic selves. I hope for you that each of your patient encounters is a blessing where you can allow your skills to be used by your patients in a way that is meaningful to them. This will be my last year as your physician lead. It has been my immense pleasure to work in this position alongside Tracy and Peggy and the rest of the SNO board. And I also look forward to helping the new leadership as they transition into this role. Thank you very much for all of your support.
So my grand adventure started last August 3rd. I had a heart attack that landed me into Shuswap Lake General Hospital, and the following week for a triple bypass in Kelowna. When I left there, getting up my stairs was a challenge, and I left with the instructions to increase my walking every day. Easier said than done. But as my doctor told me to listen to my body, and as time went on, I was more able to move. And I got a nice call from IH saying that you can go to cardiac care or cardiac rehab in Vernon. And I said, no, I'm not going to ask somebody to drive me there and give up half their day. And so I phoned Heather Stanton, whom I've known for a long time, and said, so are you offering this? And she said, funnily enough, I'm just working with Dr. McKee to get that in line. So I waited for her, but in the meantime, pushed my wagon up the hill to Okanagan and back down every day. And as soon as I could, my doctors, both of them were delighted to sign me up for the cardiac rehab, and off I went. And I'll tell you what, right from day one in ICU, I had a vision of myself snowshoeing up at Larch Hills. And when I went to see my surgeon at 8 weeks, he was maybe flat by February. Well, on January 11th, I sent him a picture of me doing this up at Bilbo's Bog after the steep part of the climb, and sent him an email saying, thanks again for saving my life. Here is where I am a month ahead of where I had seen myself doing that. And I give most of that credit to Heather, who is so competent, knows exactly where you need to be, and gently pushes you if she thinks you need it, but also gives you a lot of support. And I started trading off some of the treadmill work. I'd do about 25 minutes on the incumbent bikes, and then I'd take my dog for a walk. And now I'm having a hard time. What used to take me 20 minutes to do, I'm done in about 5, and having to expand my walk. And I really think having that cardiac care, and I wouldn't have gone to Vernon because I wouldn't have asked anybody. And to have it here and to know that I'm getting it from somebody who knows what they're doing is awesome. And I would recommend it to anybody. Yeah, it's a bit of a push, but when my doctor told me to listen to my body, he also said, the choice is yours. Do you want to be a little old lady in a wheelchair, or do you want to live? I choose living, and now that I've had to hang up my snowshoes, I'm ready to get the kayak out.
My name is Heather Stanton, and I'm one of the owners here at Proactive Fitness, and we've been running the cardiac exercise program here. We started in the fall of 2016, and the program actually started several years ago, but sort of fizzled out, wasn't sustainable without sort of the support of everyone. So with Dr. McKee this summer, we came together with other health administrators, nurses, and a dietitian to come up with a plan to get the referrals to get this program going, so that we're all working together and getting the referrals going and supporting people to adopt a healthier lifestyle. So the program here is an individual program within a group setting. So with that, everyone has sort of their own program, but they come together at a similar time. So everyone's doing what they need to do at the intensity that's right for them, but they also have the support of the group, and I'm able to circulate around and help everyone proceed at their own pace.
My name is Shannon Hecker, and I am here from the Canadian Mental Health Association. And I just want to take this opportunity to thank SNO for all of the great relationships that we have, and for their efforts in promoting wellness and health in the community. So the program that I am currently coordinating is called a Gatekeeper program, and it's about suicide intervention. So the idea is that provincially we are going to train anybody and everybody in the community. That means family members, friends, neighbors, doctors, medical office assistants, school teachers, students, to be suicide alert. So the idea is that we can create suicide-safer communities when we have people who can identify signs and invitations that people may be giving that they are a person at risk of suicide, and then to be able to ask them openly and directly about suicide, and then to quickly connect them to resources. So SNO is kindly sponsoring Safe Talk in the community. So that means that in school communities that we're looking at parents and teachers and students, and not only just in Samanar, but also in Enderby, in Sicamous, and also in Vernon. So thank you for that. But of course, when we look at suicide and suicide prevention, it's not just help. It's not just intervention. We also need to look at the people who have lost people to suicide. And so SNO has also offered some seed money for Canadian Mental Health Association to really connect with hospice and other community supports to be able to look at what we can do for people around suicide bereavement. And so that will look hopefully like asking the community's input into what would be helpful and caring and useful And really, SNO is really just wanting to nurture the community collaboration around suicide and have conversations around it. Also, on the hope side of things, because of course we don't just have the help and intervention of suicide and the healing part and the suicide bereavement, but we also have hope. And so on the hope side, we're looking at creating a proposal to look at pathways to care for lesbian, gay, bisexual, transgender, and two-spirited youth. Just looking at how we can better provide service to them in more rural and remote communities so that they don't have to go so far abroad for the help and care that they need.
Well, hello, my name is Elizabeth Watson. I'm a GP here in Manor. I started working here in May 2015 full-time. We did a couple of locums here prior to that, and then we settled down. So I've been asked to speak about the Pathways program, which is a new SNO initiative. I guess it's not that new, but it's new to me, and I apparently am one of the highest users of it in the area, which I don't know whether that's a good thing or a bad thing, but it has been extremely helpful for me. So being a new doctor to the area, I didn't do any of my training here. I didn't do med school in the southern half of the province. So I came into the area basically relying on recommendations from colleagues and my own limited knowledge of the local area for figuring out who I was going to refer my patients to when they needed specialty care, which happens a lot. So prior to Pathways becoming an option, I sometimes would Google, I sometimes would run down the hall and ask someone who'd been here longer than me. Sometimes I would just look in our clinic database, but there are a lot of doctors in that system who either are not in practice anymore, who are not actively taking patients, or just weren't an option for other reasons. So sometimes my referrals got returned to me, sometimes patients got phone calls saying it's going to be an 8 to 10 month wait. And it was a bit of a challenge. Sometimes it was pretty frustrating and I was re-referring people or sending them to other places. So when Pathways came around, it seemed like a pretty sweet service. And I use it mostly when I know that my patient needs a specific person, but I don't know who that person is yet. And when I feel like I don't necessarily want to use someone who I know the wait list is quite lengthy. So I've used it to find specialists in Vancouver, I've used it to find specialists in Kelowna. I really like the main page where they update it with people taking new patients in the area. I was actually able to refer a friend who had asked me to take on one of her patients who lives in Kelowna but can't find a GP and was actually willing to drive to Salmon Arm to see a family doctor. I was able to tell her to refer him to a new GP who was taking patients in Kelowna that I had no idea who she was, but her name showed up on the main page of Pathways, and it hopefully will allow the patient to avoid an hour and a half of driving each way to come see a family doctor about their workplace injury. One of the especially nice things about the information provided on the site is the estimated wait time for each specialist. I have found that useful because sometimes it isn't particularly urgent, but sometimes it is urgent enough that I'd like to know what I can tell the patient to expect. And I think that helps the patient because a lot of times the stress that a patient experiences is just not knowing how long it's going to take to get in to see a specialist, and sometimes being able to say, you know what, according to this, the wait time is 4 to 8 weeks as opposed to 6 to 9 months for the rest of the list. So we anticipate that you'll hopefully be seen sooner than if I'd sent you to someone else that I already knew about. I guess the bottom line is that for me, it's provided a really good resource as a relatively new physician to the area. And I'm pretty grateful that it's been created and is being updated regularly and continues to provide a really easy to access, easy to use, handy-dandy resource.
My name is Doug Murray, and I'm currently the past president of the Shuswap Hospital Foundation and also the committee chair for our participation in the Palliative Care Committee, which has been running for a number of years, in which SNO is also a member and one of the leads in that as well. So we've had the pleasure of working with the group of physicians and employees from SNO and some of the retired physicians as well, in working towards improving palliative care throughout our community for the last, in earnest, our participation for the last 2 years. So with that, we helped redevelop 2 beds within the hospital for palliative care uses, so some different equipment, different sorts of beds and different comforts for families. The work with the committees and the design, so about $121,000 to help develop these, and had some great participation both from palliative care committee members, so SNO itself has committed $30,000 and have provided $10,000 of that already, and then a subsequent $20,000 over the next couple of years. And 3 of our Rotary clubs in town, a total commitment from them, totaling about $25,000. And we've received all of that funding, some of it just recently from the Rotary Club, so some great participation. We put that together, I suppose, with our fall campaign as well. So the Shuswap Hospital Foundation runs a number of campaigns through the year, and the fall campaign is pretty much our premier, one of our premier fundraising times, as a lot of nonprofits benefit from the fall Christmas year-end part. So out of the $121,000 cost for these rooms, we've raised about $91,000 to date. There's about $30,000 left, and we're confident, just in mentioning it, continuing to talk about the need to talk about the palliative care rooms, that we can meet that objective quite easily.
Hello, my name is Kristine Larsen, and it was my pleasure to assist the SNO Division with one of its significant accomplishments this past year. Doctors in BC had noted for some time that it can be really challenging knowing where to turn when patients needed help in managing their health or social circumstances. In 2013, physicians in Nanaimo came up with an answer: create a custom-built online resource of health, social, and community services that both healthcare providers and the public could easily access. And that is how FETCH was launched. FETCH, or For Everything That's Community Health, was quickly recognized for its value throughout the province. Thanks to local family doctors who worked together within the SNO Division of Family Practice, it became available to residents of the Shuswap in North Okanagan in 2016-17. In this new local edition of FETCH, the letter E really does stand for everything. The website is a one-stop directory of resources ranging from counseling to employment assistance, and from prenatal care to meal support for seniors. Local is a key ingredient, as FETCH allows each person to focus their search on their own community, whether they live in Chase or Lumbee or any point in between. Information is also available on the website regarding key provincial and national agencies, such as the BC Cancer Agency and Health Canada. In all, there are more than 700 services and agencies currently listed in the local edition of FETCH. The SNO Division is committed to making the directory as comprehensive as possible, and it's taken on the responsibility of keeping FETCH up to date so users can count on accurate information. So when your patients are looking for information about health and social services that are available in North Okanagan and Shuswap communities, FETCH can bring it right to them.
The Unused Medication Return Project was created to both raise awareness of the dangers of misuse of unused and expired medications in the Vernon community and outlying areas, and encourages the public to return these medications to their local pharmacy. The project was guided by an informal committee consisting of individuals from the 3 sponsoring agencies, as well as from other community resource groups and individuals. The committee wanted to ensure that the project targeted the general public and focused on awareness and danger of medication misuse. As well, the committee selected 2 days to host an event where the public would be encouraged to drop off any unused medications. Overall, this was a successful endeavor. Many people in the community were reached through this sort of project, and as a result, more medications are now out of harm's way and have been disposed of properly. There is still more work to be done and more people to be informed. It would be advantageous to continue the momentum to make this an annual program. Guided by information learned from this 2016 campaign, the annual Medications Return Project could have a very positive impact on our community. Our CME events this year are here to continue to bring awareness and provide a great forum for interaction between other healthcare professionals, as well as bring new information to our local healthcare community. We hope you will find the information contained within these CME events valuable to you and your patients.
My name is Monica, and I'm a parent of a youth with mental health challenges, and I'm one of the co-chairs of the Shuswap Local Action Team.
And I'm Kara, and I'm the project lead for the Shuswap Local Action Team. The main objective of the collaborative is to increase timely access for children, youth, and their families to access mental health and substance use services. Our local action team consists of various stakeholders, including School District 83, Interior Health, Child and Youth Mental Health, Shuswap Children's Association, Shuswap Family Resource Center, the Save Society, CMHA, RCMP, and our doctor representative, Dr. Richard Curry, as well as parents and youth with lived experience.
Our team was one of the first local action teams started in the interior, and the Shuswap North Okanagan Division of Family Practice was integral in giving us our start. Coming together as youth, families, and service providers in a small community to work together was new for most, if not all of us. The local action team has been working together for 3 years now, and as we head into the 4th year, we have a better understanding of the gaps and services needed for children and youth with mental health challenges and their families in this area.
Many of our families live in rural communities, making it difficult to access medical, mental health, and substance use services due to lack of transportation, limited hours of service, and other factors. In a recent survey by School District 83, we learned that approximately 20% of students attending SAS, Jackson, and Sullivan rely on busing, making it virtually impossible to see a GP or other mental health or substance use service provider.
Last spring, Kara held a small meeting with just our parents with lived experience on the team to give us an opportunity to share without worry or judgment at a regular action team meeting that has time constraints and where she could actively listen. In our first meeting, our other parent, Colette, who is also a local pharmacist, and I started talking about the work Langley and Nanaimo were doing with their youth wellness centers and the involvement of their division of family practice.
In a following meeting with our local action team, our parents put forth the idea of looking into establishing a youth wellness center in a local high school, possibly SAS Sullivan, and there was a resounding show of interest and support, especially from Dr. Richard Curry and SAS Vice Principal Pam Hudiak. From there, a subcommittee was formed.
Our subcommittee has identified a need for an innovative and responsive youth and family-centered health center to address local barriers and meet growing clinical needs. Being located in the SAS Sullivan campus or possibly Eagle River Secondary or A.L. Fortune Secondary, youth would be able to have their health and wellness needs met without leaving the school grounds. The school district shares the same concerns regarding their students, and with the recent cutbacks to mental health support staff, this would benefit the school on many levels.
We believe that in creating a wellness center modeled after several centers and hubs throughout the province, but tailored to our area, it will reduce the barriers to those youth needing services who are unattached or unable to access services. There are several divisions of family practice that have worked with local action teams in the province to develop youth centers or hubs in their community.
By creating a first-stop shop clinic where our youth can present and receive immediate attention, be connected to a variety of services without having to tell their story repeatedly, located in a safe, youth-friendly environment, increases the chances of us catching youth who are unattached or unfamiliar with programs and services before they fall through the cracks.
The subcommittee determined that we needed to hire a short-term consultant researcher to do an environmental scan and determine what is needed from all supporting agencies for a youth wellness center, and to use that information to develop an implementation strategy. This person would engage closely with stakeholders, determining their level of involvement and contribution, as well as constructing a plan for implementation. Our funding protocol with the collaborative is such that we are unable to compensate someone to do this research and development strategy of the project, so we asked the Shuswap North Okanagan Division of Family Practice to fund the consultant.
Part of the foundation of the Child and Youth Mental Health and Substance Use Collaborative is having the voices of youth and children involved in every aspect of planning, projects, or the work that we do. Parents and youth with lived experience will also be consulted about the Wellness Center, as well as frontline staff in the mental health and substance use fields. These interviews and consultations will allow us to better engage youth, families, and partners towards the success of the clinic.
SNO is an integral partner in this project, which aligns with your evolution of care. Our goal is to open the Youth Wellness Clinic in one of our local high schools at the beginning of the school year in September 2017.
SNO Division holds approximately 3 or 4 MOA sessions per year, and I attend every one. I find them very, very valuable for networking as well as information gathering. They always bring valuable information. They'll have a topic that they teach us visually. We have handouts, and that is extremely helpful in that the MOA learns and can then take that back to the office for the family physician, because family physicians are very busy, and for the MOA to know the information and learn the information and be efficient at the information, then to show the doctor is much easier than having the doctor read through or have to watch a video, because let's face it, doctors are all very busy people. So at least this way, if the MOA can see the benefit in any of these learning sessions, they will take that information back to, and show the family doctor. They always have very interesting topics, whether it's billing or electronic medical records, or just current information coming down the pipe, anything new, we learn about it there. Another value I find in these meetings is the networking, in that if you have something in your office that's not working for you, or something within your EMR program, or even billing questions that you're not sure of, you bring it to these sessions, and sure enough, somebody else in another office has had the same situation pop up, so you get ideas how they run it in their office, and I find huge value in that.
So this whole idea really started out with a conversation just after a ride in the park, and we were sitting down and chatting a little bit about some of the work that Hamish Wang has done locally. He's one of our local surgeons, and some of the work that he's done with colon cancer screening, and talked about people showing up to the emergency room presenting with colon cancer. And really made the argument in some of his research that look, if we could have more scope time, that we could do better with this, that we could actually save patients, and in the process we could save some money. So brilliant argument, got the statistics, made the argument, and then presented that to people who hold the money, and they pay for scope time. And so now we have much better scope time than we did when I got here. And just one example of some of the things that he's done that have really, I think, changed some of the practice here, some of the real pain points in our practice, and really made care better for patients. And I think that's an example of some of the kinds of things that it would be nice to do a few more projects like that. There are a lot of things that we complain about every once in a while that we think, oh, we could do better, this could be better. When I thought about the divisions of family practice, I was also already working with them, and divisions, I think, really has a lot of potential and is pretty uniquely positioned, I think, to make an impact in this area. And so I thought, you know what, if somebody could put it together so that we'd have a research program here in Vernon and in the North Okanagan, something that would affect Salmon Arm and Vernon and the surrounding area, and do research that was relevant to our patient population, to our group, that I think that can make a real difference. I presented that to them, and they said, great, go ahead. So that's That's how I became involved. We know that not everybody's going to be a researcher. Not everybody's going to drop their family practice and focus on this. These are the kinds of things that we thought of before our lives became consumed by our practices and all the things that we do outside. These were, a lot of these things were ideas that we had coming out of med school. I'm going to do some research, but it never happened. There are things that you can do, even if you're just going to complain. If you can articulate that in a reasonable way and then share it with us, we can do something about that. Even better if you have an idea about how to fix it. That'll be fantastic. From there, if we have people who are willing to collaborate on that, that's even better. But if we have the structure in place, at least people can get involved and do something about it. So I'm hopeful that that's what people will do, and that we can build a culture around that where everybody's at least thinking, you know what, here's something that's painful about medicine here. Here's something that's just not working. What can we do about this? And then at least they have some place to talk about it and say, what can we do about this? So bettermedicine.ca is the website representing this effort of creating locally relevant research that can really make a difference for our patients in the North Okanagan. That's what we're trying to do. So it's a place you can go, find out what the resources are that are available and how you can be involved.
Hi, I'm Debbie, and this is my mama, Fran. And we're here to talk about music and memory. And it has just done the most wonderful things for her because she was raised in a very musical family, and as I was, obviously. She was in Polson Mall for a while, and she lost her speech. And when she came here to Pleasant Valley Manor.
Did Rita see her little dress?
Yes, and she was put in the music and memory program. I can actually have conversations with my mom again, and it's just so wonderful that I've got my mama back. So that's kind of, as you can see, she's unbelievably happy here. And I think a lot of it's because she gets her music every day without fail. So she's so special to me, and they take such wonderful care of her here. So this program is something that I think is vital to our elders, that it gives them a place to go when they might get agitated or frightened. So she's in the best place she can be here, and this program has given my mama back to me.
Hi there, I'm Candace, the recreation therapist here at Pleasant Valley Manor. I wanted to say thank you to the North Okanagan physicians and Shuswap physicians for coming on board with the program. We now have Pleasant Valley Manor, Parkview Place, Olson Residential, Gateby, and Norick House all have started up the program. So we're very excited about that. It has been a success for many of our residents, leading to increased joy, increased happiness, some increased communication, some decrease in agitation, and definitely we're seeing a decrease in some medication use for our residents, which is fabulous. The other piece that I wanted to mention is that the North Okanagan homes that have just come on board are now in the process of collecting data for the Music and Memory program. So we've done some pre-observations and data collection around wellness, agitation, and medication use. And now through the implementation, we're doing some observations and data collecting at 1 month, 3 months, and 6 months to see the impact of the program. So we're really excited about that. So thank you to the North Okanagan physicians and Shuswap physicians for your contributions and belief in the program.
So what's happened with this music and memory program is before in other facilities, and even when she was living with me, she would become certain times of the day extremely agitated. And the only way we could control it was with medication. And however, since she's come here, it's been the music and memory. Medication is now an absolute last resort. And the music in memory, they plug her in, and it's like going from here to there, and puts the smile on her face. So it's so wonderful, a program that I think all elders, if they have any inclination with music or for music, it just puts them in a happy place, and that's where we want our parents to be all the time. Not upset, not lonely, just happy. That's their end years, and look at that smile.
As you can see, 2016 and 17 has been a very busy year for the division. We have continued to support you and your MOA in your practice through the various initiatives such as Pathways, CME and MOA events, recruitment and mentorship of new physicians, the Refugee Interpretation Service, and the newly launched Family Physician Research Hub. The division has also supported your patients and your community by developing collaborative relationships with various community partners. These relationships have resulted in tangible, positive outcomes for families and patients, specifically with regards to the following: the renovation of end-of-life beds in Shuswap Lake General Hospital, lighting up of the faces of our residents in residential care through the Music and Memory program, providing cardiac exercise programs to Manor residents and patients, supporting a grassroots mental health promotion and awareness within our schools and communities, exploring the opportunity for a wellness center in our high schools, creating awareness and promoting the safe return of unused medications in Vernon, community education on topics such as end of life and advanced care planning with Dr. Trevor Jans, as well as creating welcoming communities for our refugees, supported by Dr. Samantha Nutt. Navigating community resources through Fetch, the online community resource directory. 2016 and 17 saw renewed and improved relationships with our healthcare partners, where we are focusing on strengthening the patient medical home. Preliminary work is being done in Vernon, where we are trying to co-locate the integrated care teams within physicians' offices. Stay tuned for updates on this exciting work as this work continues to develop. I believe the success of this year has been a result of our own organizational development and growth, as well as the relationships that we have fostered with our community and health authority partners. Quoting John Casson-Bath, "Culture can become a secret weapon that allows for extraordinary things to happen." I would like to thank the board, and specifically Dr. Melany Dyer, for their continued support and leadership of the division. By creating a culture that focuses on our values, we are able to make the extraordinary happen. My right and left-hand warrior, Peggy Crow, may hover in the wings, but she's instrumental in making sure that the machinery of the division ticks over as efficiently and effectively as it does. Thank you, Peggy, for everything that you do for us. It is my honor, privilege, and pleasure to work for the SNO Division of Family Practice. I look forward to the new year as we continue to make extraordinary things happen.